Hello, my name is Kathy Quarles-Moore, and I'm an associate professor at the University of South Carolina College of Pharmacy. I'm also a practicing independent community pharmacist, and today I'm going to be guiding you through some of the top 300 drugs that we use in community pharmacy. Okay, y'all, this section is going to include endocrine drugs, or drugs that are used for the endocrine system. Some of these drugs include drugs for diabetes, osteoporosis, and hormonal contraceptives. Also, women who are postmenopausal can be in this section as well. A lot of these drugs that are in here are drugs that we use for women's health, and sometimes we can compound these drugs too. This is not the be-all, do-all, but I just want you to know that this section includes a lot of the endocrine drugs.
Biguanide anti-diabetic agent is metformin, and the brand name is Glucophage or Fortimet. And you notice the met in the Fortimet, metformin. Glucophage, glucose. You can kind of remember that lowers the glucose. I try to think of things that will help me. And they may be little things, but I think they're big things. Indicated for diabetes. One of the side effects, or several side effects, of metformin are stomach related: diarrhea, nausea, and flatulence. So this is a weight-neutral drug. Sometimes you have to titrate the dose and take it with food. Definitely take it with food to reduce stomach effects. Sometimes the ER formula can leave a ghost tablet in the stool. This drug can cause a vitamin B12 deficiency. That's important. And also, it's got a black box warning for life-threatening lactic acidosis, which could be possible. Dipeptidyl peptidase. 4 DPP4 inhibitors. First one we're going to talk about is sitagliptin. The brand name is Januvia. The oral combination with metformin is Janumet. So this is kind of cool. Look, Januvia, and then there's Janumet. So Januvia is the first part of this drug, with the metformin the second part of this drug. So you see, Januvia and metformin. It's indicated for diabetes. It's generally well tolerated, but it does have some serious adverse effects, such as arthralgias, pancreatitis, and acute renal failure are possible. So that's important to talk to your patients about. Also, you don't want to combine the GLP-1s with the DPP4 inhibitors. Okay, there's no additional benefit in the combination. It might be wise to avoid this drug in patients with heart failure. Another DPP4 inhibitor, linagliptin, brand name Tradjenta, indicated for diabetes, and it's generally well tolerated, just like the other DPP4 inhibitor. Same side effects, same warnings and contraindications, linagliptin, Tradjenta. Another DPP4 inhibitor, saxagliptin, brand name Onglyza. All right, indicated for diabetes. This drug is generally well tolerated, but it talks about, you need to make sure your patient doesn't have heart failure because you want to avoid this. If you look at the warnings and the contraindications, saxagliptin increases the risk of hospitalization due to heart failure. So avoid it in congestive heart failure patients. Potentially, the serious adverse events of arthralgia, pancreatitis, and acute renal failure has the same with this DPP4 inhibitor as well as the others. All right, let's look at sulfonylureas antidiabetics. Glimeperide, brand name is Amaryl. It's indicated for diabetes. It's contraindicated in a sulfa allergy. That's important to make sure you know your patient's allergies. It has some side effects, which are weight gain and nausea, and you can potentially have severe hypoglycemia with this drug. Important to counsel your patients on hypoglycemia, what the symptoms are and what to do about it. Very important. You want to take this drug with breakfast, and this drug is on the Beers list for older adults, so be careful. Another sulfonylurea antidiabetic is Glipizide, brand name Glucotrol. It's indicated for diabetes. It's also contraindicated in folks with sulfa allergies. It also has that warning of severe hypoglycemia possible. So you need to make sure, again, that you counsel your patient on the symptoms of hypoglycemia and also tell them what to do about it. The ER dosing may leave a ghost tablet in the stool, and also the immediate release dosing should be taken 30 minutes before breakfast. Sodium glucose cotransporter 2, SGLT2 inhibitors, antidiabetic, and I'll refer to these as SGLT2 inhibitors. Dapagliflozin, brand name is Farxiga. The common indication is diabetes and heart failure with reduced ejection fraction. That's a recent indication. Chronic kidney disease. Some of the side effects: weight loss, increased thirst, and urination. And some of the drug interactions with this drug is to be cautioned with combinations of insulin or other medicines causing hypoglycemia. That's important. Another SGLT2 inhibitor antidiabetic is Canagliflozin. The brand name is Invokana. Indicated for diabetes. Again, the side effects the same as the other SGLT2. Weight loss, increased thirst and urination. Not approved for use in heart failure or chronic kidney disease. This drug does have a warning that talks about it having an increased risk of amputations and hyperkalemia compared to others in its class. Important to note. Another SGLT2 inhibitor, Empagliflozin. The brand name is Jardiance. It is used for diabetes, heart failure with reduced ejection fraction, HFrEF, chronic kidney disease, and it also, just like the others, can cause the same side effects: weight loss, increased thirst, and urination. Let's go to a class of drugs called glucagon-like peptide 1 receptor agonist, antidiabetics. I'm going to refer to these as GLP-1 agonists from here on out. Exenatide. It's Byetta, twice daily dosing is subcutaneous dosing, and Bydureon. It's once a week dosing subcutaneously. It's indicated for diabetes, and the side effects of the GLP-1 receptor agonist: weight loss, nausea, vomiting, and diarrhea. It's injected subcutaneously in the abdomen. You could also inject it in the thigh or upper arm. Just make sure you rotate those injection sites. A big black box warning is increased risk of thyroid C-cell carcinomas, and it's not recommended for patients with severe GI disease, and it also has a potential for pancreatitis. Another GLP-1 receptor agonist antidiabetic is liraglutide. Subcutaneous, brand name is Victoza. Once daily dosing. It's used for diabetes. The side effects are very similar to the others, are the same: weight loss, nausea, vomiting, and diarrhea. Same black box warning and risk. Contraindications are the same as well. Another GLP-1 receptor agonist, dulaglutide. The subcutaneous dose is Trulicity. Once weekly dosing. Common indication is diabetes. Black box warning is increased risk of thyroid C-cell carcinomas. Side effects are the same as the others, and it's also injected subcutaneously in the abdomen. May also rotate sites in the thigh and the upper arm. Same warnings and contraindications. GLP-1 receptor agonist, another one, is semaglutide. The subcutaneous dose is Ozempic, which is once a week, but it also has an oral dosing form called Rybelsus, which is once daily dosing. It's indicated for diabetes. Some of the side effects: weight loss, nausea and vomiting, diarrhea. Very same black box warnings and contraindications as the other GLP-1 receptor agonists. Let's go to a class of drugs called TZDs. That's a hard drug to pronounce. Pioglitazone is the generic name for Actos, which is the brand name. It's indicated for diabetes. Some of the side effects: peripheral edema and weight gain. You have some black box warnings here. Do not use in class 3-4 heart failure. Some of the warnings and contraindications are swelling, risk of fractures, and increased risk of bladder cancer. All right, we're moving along to our insulins. Insulin aspart. The brand name is Novolog, and it's indicated for diabetes. Side effects would be weight gain and injection site reaction. It's important to talk to your patients about rotating sites And definitely do not administer this during a hypoglycemic episode. It's important to counsel your patients, again, on hypoglycemia, what the symptoms are, and what the treatment is. It is also possible that this can cause not only hypoglycemia, but hypokalemia. But hypoglycemia can be a life-threatening situation, so make certain that you are counseling your patients with any of these insulins. Another rapid-acting insulin, Insulin Lispro. Humalog is the brand name, indicated for diabetes. Side effects are the same: weight gain, injection site reaction. That's why we tell patients to rotate sites. And again, make sure you counsel on hypoglycemia, symptoms, and how to treat that. Very important. Another insulin that is rapid-acting is insulin glulisine. Apidra is the brand name, indicated for diabetes. Same side effects, same warnings and contraindications. Again, we're going to talk about hypoglycemia. Talk to your patients about the symptoms of hypoglycemia and what you're going to do to treat it. Insulin rapid-acting, regular insulin. Brand names, Humulin R and Novolin R. Common indication, diabetes. Side effects are the same: weight gain, injection site reaction. Warnings and contraindications are the same. Insulin intermediate acting, insulin isophane. Brand name, Humulin N or Novolin or Novolin N. Indicated for diabetes. Same side effects: weight gain, injection site reaction. And remember the warnings and contraindications important with this insulin too. Same, hypoglycemia. Insulin long-acting, insulin detamir. Brand name, Levemir. Indicated for diabetes. Same side effects, warnings, and contraindications as the other insulins. It's just longer-acting. Insulin long-acting, insulin glargine. Brand names, Lantus, Basaglar, and Toujeo. Indicated for diabetes. Side effects are the same. Warnings and contraindications are the same. Insulin long-acting, insulin degludec. Brand name, Tresiba. Indicated for diabetes. Same side effects, warnings and contraindications as the others. Premixed insulin, insulin NPH 70%, regular 30%. Brand names, Novolin 7030 or Novolin 7030, Humulin 7030. Indicated for diabetes. Same side effects that you see here and warnings and contraindications as the others. Premixed insulin, insulin protamine 70%, rapid acting 30%. These have the brand names Novolog Mix 7030 and Humalog Mix 7030, indicated for diabetes with the same side effects, warnings, and contraindications as the others. All right, let's go to the anti-gout agents. Colchicine. Brand name is Colchris. You notice Colchicine, Colchris, indicated for gout. Side effects will be nausea and diarrhea, myopathy and neuropathy. Very important. Sometimes patients don't want to take this because they have the diarrhea and they have the nausea, but you need to tell them this is a side effect that's probably going to happen. And usually what they do is they take 2 tablets at the first sign of the attack and then 1 hour later take another tablet. One thing, warnings and contraindications with this drug, myelosuppression is possible, and it could cause some neuromuscular toxicity, which includes or could include rhabdomyolysis. Xanthine oxidase inhibitor, anti-gout agent. Allopurinol, brand name Xyloprim. It's used for gout, side effect, nausea, and it can also cause acute gout attacks. Isn't that weird? Hepatotoxicity is possible with this drug. Very important to let your patient know that. And possibly hypersensitivity reactions like Stevens-Johnson syndrome, potentially. This drug should be taken with meals and consuming lots and lots of fluids. Very important. Another xanthine oxidase inhibitor anti-gout agent is Febuxostat. Uloric is the brand name. Used for gout. It also has a side effect of nausea or increased LFTs. And this drug in particular has increased the cardiovascular death in patients compared to allopurinol. So it's probably best reserved for patients who are intolerant or non-responsive to allopurinol. That's important. If you have patients like that, you do need to talk with them about the potential to be aware. And with this one, hepatotoxicity is possible as well as Stevens-Johnson syndrome. Biphosphonate osteoporosis agent. Alendronate. Brand name is Fosamax. The common indication is osteoporosis. Some of the side effects are dyspepsia and heartburn and nausea and vomiting. And this drug, oh my goodness, you have got to counsel your patients on this drug. They take it in the morning with 6 to 8 ounces of water at least 30 minutes before food, and they need to sit upright or stand for at least 30 minutes after taking it. That's very important. They need to also separate from calcium antacids, iron, or magnesium by at least 2 hours. This drug can cause osteonecrosis of the jaw. That's important, and I have seen that before. So very important to let your patient know that. Make sure they're getting good dental care. Another biphosphonate osteoporosis agent is Ibandronate, brand name Beniva, indicated for osteoporosis, and it has the same side effects, the same warning and contraindications as the other biphosphonates. And you need to let them know to take it in the morning, 6 to 8 ounces of water, at least 60 minutes before food, and stay sitting upright or standing for 30 minutes after taking. Another biphosphonate osteoporosis agent is Resondronate, brand name Ethinyl, indicated for osteoporosis, same side effects as the other biphosphonates, same notes, same warnings and contraindications. Part 2 of the endocrine section. Let's talk about selective estrogen receptor modulators, SERM, which are postmenopausal osteoporosis agents. The first one I'm going to talk about is raloxifene. The brand name is Evista, and the indication is osteoporosis in postmenopausal women. Some of the side effects are peripheral edema, hot flashes, arthralgia, and leg cramps. There is a black box warning with Evista, or raloxifene, that says there's an increased risk of VTE and death due to stroke in women with CHD. So be prepared to counsel your patients. They need to make sure to watch for that. Also, you need to, this is a really, really great tip, and I have to tell my patients this, and I have to remember to do it. When they're going on a trip, if they're riding on a plane for several hours, they need to discontinue this raloxifene 72 hours before and during prolonged immobilization, because there is that risk of thrombus. And I have had to tell them, okay, if you're flying on a plane 72 hours before, you don't need to take it. That's important. Progestin, which is an oral contraception product, norethindrone. The progestin generic name is the brand name for Heather or Camilla. What pretty names they have for progestin. It's indicated for contraceptive birth control. Some side effects are menstrual bleeding irregularities. The one thing that you need to counsel your patients on with these products is to take it the same time each day. And if the dose is taken more than 3 hours after the scheduled time, you need to probably think about using backup contraception for at least 48 hours after. And it's contraindicated in breast cancer, pregnancy, or active liver disease. Another progestin is medroxyprogesterone. Notice progesterone, Provera, progestin. This is a progestin oral contraception product, and it is also used for contraceptive birth control, but it's also used for menstrual irregularities. And I know it sounds kind of crazy because this says the side effect is for menstrual bleeding irregularities, but it also can be used if women have not started their cycle. Sometimes they will prompt it with giving the medroxyprogesterone. The same notes and side effects as the other oral contraceptive progestins, and also it may increase the risk of cardiovascular disease or cancer if combined with estrogen components too. There's an injectable progestin contraceptive product that's called medroxyprogesterone, same drug, and it's sub-Q or IM, and it's known as Depo-Provera. Provera is the same name as the medroxyprogesterone tablet, but depot means going to be injected. Just remember, depot is an injection. And I always think of that because this can be subcutaneous, but I think of it being deep. Lasts a long time. Also, the same side effects could occur, and the use of this product may increase bone mineral density loss, and it's not recommended to exceed 2 years maximum for medroxyprogesterone injectable Depo-Provera. Conjugated estrogens. The oral conjugated estrogens name is Premarin. And you know how they got that name? If you don't already know this, you're going to learn something new. Pregnant for mare, this is horse's urine. Pregnant mare's urine. And that's where they got the estrogens from, the pregnant mare. That would be a pregnant mare horse. I'm like, oh, this is so crazy. But that's how they named it. And if you look at some of the names of different products, you might find some more interesting facts, fun facts. It's a hormonal therapy, and some of the side effects of the conjugated estrogens: headache, abdominal pain, breast soreness, back pain. The black box warning is there is an increased risk of endometrial cancer, cardiovascular disease, breast cancer, and dementia. And you need to make sure that you talk to your patients about these side effects and contraindications. Another estrogen is Estradiol. It's an oral estrogen. The brand name is Estrace. It's a hormonal therapy with side effects very similar to the Premarin: headache, abdominal pain, breast soreness, breakthrough bleeding. And it has the same black box warning and the same warnings and contraindications. Now, estradiol also comes in a vaginal form. It's called Vagifem. It is a hormonal therapy with the same side effects and black box warning and warnings and contraindications as the tablet form. Estrogen transdermal patch. There's also a topical estradiol that's in a patch. It's called Vivel Dot, Estraderm, or Climera, which are all the brand names for the estradiol topical. It is a hormone therapy with same side effects as the estradiol tablet and vaginal cream. There is an estrogen-progestin combination used in postmenopausal women, and it's called estradiol norethindrone. And if you remember, we've had both of these before. Estradiol, we just finished talking about, and norethindrone, we just finished talking about just a few slides earlier. So estradiol is the estrogen, norethindrone is the progestin component, and it's a combination. And the brand name is Combi Patch. And the side effects are the same as the estradiol: the headache, abdominal pain, breast soreness, weight gain. The black box warning is the same, and the warnings and contraindications are the same. Here's another combination product, estrogen progestin combo. It's an oral contraceptive. It's ethinyl, estradiol, and drospirenone. So the estradiol component right here, ethinyl estradiol, is the estrogen. You can tell it because the estradiol. And the drospirenone is a progestin component. The brand name is Yasmin or Yaz, and it is a birth control contraceptive pill. Side effects are nausea, bloating, breast soreness, weight gain. There's a black box warning not to use in women over 35 years of age who smoke. Very important. Some of the warnings and contraindications with these products could be a migraine with aura, breast or liver cancer, and or uncontrolled hypertension. One of the counseling points is if one pill is missed or late, take the missed pill as soon as possible and take the next scheduled dose. If 2 or more are missed, take the most recent missed pill as soon as possible and take the next dose as scheduled. But you need to tell them to use backup contraception for at least 7 days. Another estrogen progestin combo oral contraceptive is ethinyl estradiol, estrogen component, and desogestrel, the progestin component. The brand name is Kyriva, Isabloom, or Apri, and it is a birth control contraceptive tablet. Same side effects as we saw with our other estrogen progestin combo. Same black box warning and contraindications. Same advice if a pill is missed or late, and then 2 pills are missed or late, same directions. Another estrogen progestin combo oral contraceptive is ethinyl estradiol and levonorgestrel. Do you see a pattern here? Ethinyl estradiol tends to be the estrogen component in almost all birth control pills. But the product that changes is the progestin component. This is levonorgestrel, and you know the gestrels, all of those have the gestrels in them. So ethinyl estradiol, levonorgestrel. The oral version, oral form, Seasonique and Twirla. Twirla is a patch, so that's kind of interesting, kind of different. Same side effects, same black box warnings and contraindications as the other estrogen progestin combinations. Another one is ethinyl estradiol, which is our what component? Estrogen component, yes. And norethindrone is our progestin component. The brand name products would be Loestrin and Junel. Same side effects, same black box warnings and contraindications. Ethinyl estradiol and norgestimate. The progestin changes. The brand name is orthotricycline, low, and Trisprintec. Same side effects, same black box warnings and contraindications are also the same. Here is an estrogen progestin combo vaginal contraceptive, but it is kind of different. This has got ethinyl estradiol and etonogestrel, and it is a vaginal ring called NuvaRing. All right, NuvaRing. You can remember the ring is vaginal, okay? So that might help you a little bit. It is also a contraceptive birth control device. Side effects are the same as the other estrogen and progestin combos, same black box warning and contraindications. And what you do with this one is you insert the ring once a month, you keep it in for 3 weeks, and it's taken out for a week before replacing. This has to be stored in the refrigerator before dispensing it to your patients, but it is good at room temperature for 4 months. Okay, let's talk about androgens. Let's talk about the topical androgens. Testosterone. If you notice, it's a schedule control 3. Testosterone, topical, brand name is Androgel. If you look, androgen, andro, testosterone, get it? The common indication is hypogonadism in males, and some of the side effects would be increased appetite, acne, edema, reduced sperm count, and hepatotoxicity. And if you look at the black box warnings, they're very important, and the warnings and contraindications is contraindicated in prostate cancer, breast cancer, pregnancy, and breastfeeding. Thyroid hormone, synthetic T4. The generic name is levothyroxine, and the brand name is Synthroid or Levoxyl. These are tablets, and the common indication is hypothyroidism. Some of the side effects of the thyroid hormones would be increased heart rate, sweating, palpitations, irritability, weight loss. And some of the warnings and contraindications would be that it can decrease bone mineral density, and with cardiovascular disease, you need to decrease the dose. An important note, this is best taken in the morning, 30 minutes before breakfast, or at least 3 hours after the last meal. And when you go to switch these brands, you want to check the Orange Book for therapeutic equivalence. This is very, very important because not all generics are equivalent. Desiccated Thyroid. Armour Thyroid is the brand of Desiccated Thyroid. That's the brand name. It is also a tablet. It's used for hypothyroidism with the exact same side effects and warnings and contraindications. Here's a thyroid product called liathionine sodium. Now that's Southern, liathionine sodium. And the brand name is Cytomel. It is an oral tablet, and it's used for hypothyroidism. It can cause increased heart rate, sweating, palpitations, irritability, and weight loss. This one also should be taken 30 minutes before breakfast or 3 hours after another meal of the day. Here's another product called thiamide antithyroid agent. The generic name is methimazole, and the brand name is Tapazole. It's indicated for hyperthyroidism. This product can cause some side effects: stomach upset, GI upset, headache, rash, some warnings and contraindications: hepatotoxicity, bone marrow suppression, and drug-induced lupus. This one you need to take with food to reduce any GI effects. Let's look at a steroid, an anti-inflammatory, Prednisone is the generic name. Deltazone is the brand name. It is a tablet. Indication is for inflammation or immunosuppression. Some of the side effects would be increased appetite, weight gain, insomnia, and emotional instability. This drug needs to be taken with food always to reduce GI effects. And this drug also can cause adrenal suppression. This is a big warning and contraindication. You've got some people who feel so good on steroids, they think they should just stay on it forever. Not a great idea because it can cause this adrenal suppression. So you need to taper it if therapy is longer than 14 days. Very, very important. Another steroid anti-inflammatory product is dexamethasone, the generic name for Decadron. It is also indicated for inflammation, immunosuppression, and some of the side effects are the same: increased appetite or weight gain, insomnia, emotional instability, and you have the same side effects, quick notes, warnings, and contraindications. Another steroid anti-inflammatory is methylprednisolone, brand name Medrol. Indication is inflammation and immunosuppression with exactly the same side effects as our other steroids.